Thank you for joining us today. We want to paint a holistic picture of what Medicaid transformation is, who it impacts, and all the key players within it. Medicaid transformation is changing the way most people receive Medicaid services, and this will be through North Carolina Medicaid managed care. The North Carolina Department of Health and Human Services, also referred to as NCDHHS, will transition Medicaid and North Carolina Health Choice from fee for service to managed care. If you are not familiar with managed care, let me explain. Under North Carolina Medicaid managed care, the state is contracting with prepaid health plans that will assume all the risk for the members they cover. PHPs will be paid a predetermined set rate per person to provide healthcare services. Beneficiaries will be able to choose their health plan. Now that you understand a little bit more about what Medicaid transformation is and how managed care fits into that, we are going to talk about who this impacts. Approximately 1.6 million of the current 2.3 million Medicaid beneficiaries will transition to NC Medicaid managed care. These beneficiaries are referred to as the crossover population. What is the EBCI tribal option? The state is contracting with the Cherokee Indian Hospital Authority, CHIA, to support the Eastern Band of Cherokee Indians in addressing the health needs of American Indian and Alaskan Native Medicaid beneficiaries. This new delivery system, the EBCI tribal option, will manage the healthcare for tribal Medicaid beneficiaries, primarily in Cherokee, Graham, Haywood, Jackson, and Swain counties. Who is impacted? Approximately 4,000 tribal Medicaid beneficiaries will transition to NC Medicaid managed care. Now we will talk in more detail about the EBCI tribal option. The EBCI tribal option will address the unique health and medical needs of federally recognized tribal members, IHS eligible beneficiaries, and their families. Tribal members will be able to select a primary care provider that is part of the EBCI tribal option network. Here is some more information about the EBCI tribal option. The EBCI tribal option will manage the healthcare for tribal Medicaid beneficiaries primarily in 5 counties: Cherokee, Graham, Haywood, Jackson, and Swain. Eligible beneficiaries in the following counties may opt in: Buncombe, Clay, Henderson, Macon, Madison, and Transylvania. Federally recognized tribal members and IHS eligible beneficiaries living outside of the 11 counties may contact the enrollment broker to learn more about the EBCI tribal option and/or enroll. NCFAS collects tribal IHS managed care status details through data input from DSS staff. Enrollment broker call center staff can see a beneficiary's managed care status in Max EB. EBCI members and/or members of any federally recognized tribe that live in the 5 county tribal service area will receive specific tribal notices starting March 1st. EBCI members and/or members of any federally recognized tribe that live in the 5 county tribal service area will be auto-enrolled in the EBCI tribal option if they do not choose another health plan by May 14th. The EBCI tribal option will offer added services for beneficiaries who enroll. We will discuss this later in the training. The EBCI tribal option covers the same behavioral health services as NC Medicaid Direct. Eligible beneficiaries with enhanced behavioral health needs and/or are recovering from substance use will not lose any of their benefits by enrolling in the EBCI tribal option. However, they may lose benefits if they choose to enroll in another plan. Federally recognized tribal members and IHS eligible beneficiaries who live in the 5 county region of Cherokee, Graham, Haywood, Jackson, or Swain are eligible for the EBCI tribal option. Federally recognized tribal members and IHS eligible beneficiaries who live within a reasonable distance from the 5 county region may opt in to the EBCI tribal option. This includes those living in the following counties: Buncombe, Clay, Henderson, Macon, Madison, and Transylvania. IHS eligible beneficiaries include direct lineal descendants, non Indian children who are under 19 years of age, and non Indian pregnant women carrying an Indian child. CHIA determines who is eligible for the EBCI tribal option. During the initial transition period, when NC Medicaid managed care is first being rolled out, beneficiaries will have an extended amount of time in which to enroll in a health plan. Eligible beneficiaries will receive enrollment packets from the enrollment broker prior to the open enrollment period. These packets will contain guidance for beneficiaries on steps that need to be taken, as well as information about each of the health plans. During the open enrollment period, existing beneficiaries and new applicants will have about 2 months to choose a health plan. However, beneficiaries may begin enrolling prior to open enrollment. Open enrollment will begin March 15th, 2021, and will end May 14th, 2021. Midway through open enrollment, a reminder postcard will be sent out. All beneficiaries must enroll by the end of the open enrollment period. If they have not completed enrollment by the end of the open enrollment period, a health plan will be chosen for them. On the timeline, you'll see this noted as auto enrollment. A primary care provider will be assigned as well. The health plan coverage for members will start July 1st, 2021. Members may change their enrollment within a 90-day window after their health plan starts. After this window, members will be locked into their health plan choice and will only be able to make changes if they have a special with cause reason. These reasons include the member moved out of the health plan service area, the member has a family member in another health plan, the member requested related services that are not available in the health plan's provider network, the member's medical condition requires treatment that they are unable to receive with the health plan, the member received poor quality of care from the health plan, the member's long term services and supports provider is no longer available with the health plan, or the health plan does not provide the services the member needs due to religious or moral objections. If you get questions about this, you should let the member know to contact their health plan first, as there may be a way to stay within their health plan. If they still want to change their health plan, they need to contact the enrollment broker for a health plan change request form. They will need to fill out the health plan change request form and mail or fax it in. The enrollment broker is an unbiased third party entity partnering with North Carolina Department of Health and Human Services to help beneficiaries transition from NC Medicaid Direct to NC Medicaid Managed Care. We are truly independent, and our goal is to help beneficiaries select the right health plan and primary care provider based on their health needs and other factors that are important to them. An unbiased enrollment broker can ensure program integrity while helping beneficiaries select the best health coverage for them and their family. The goal of the enrollment broker is to simplify the enrollment process to make it easy for beneficiaries to understand. The enrollment broker also aims to increase the number of beneficiaries who actively select their health plan versus being auto enrolled in a health plan. After beneficiary eligibility is determined by DSS and population is determined by NC Medicaid will enter this information into NC Fast. That information will be sent to the enrollment broker, which will trigger the mailing of enrollment packets, including the notice that lets the beneficiary know if they must enroll or may choose to enroll in NC Medicaid managed care. The notice will direct the beneficiary to the enrollment broker to learn more, make their health plan and PCP choices, and complete enrollment. Beneficiaries who must enroll or may choose to enroll in NC Medicaid managed care should reach out to the enrollment broker via website, web chat, mobile app, or phone for choice counseling and enrollment assistance. Beneficiaries can receive information from the enrollment broker at outreach events throughout North Carolina. After enrolling in NC Medicaid managed care, the member will receive a welcome packet in the mail with additional information and their Medicaid card. The enrollment broker is an unbiased third party entity working with the state of North Carolina in the transition to NC Medicaid managed care. Services provided by the enrollment broker include providing a communications hub for Medicaid beneficiaries, providers, and health plans, conducting outreach and education around the transformation as we are doing now, maintaining the website and mobile app, including the Medicaid and NC Health Choice provider and health plan lookup tool, partnering with and supporting local DSS offices and community based organizations, providing choice counseling for beneficiaries, and enrolling beneficiaries in the right health plan for their needs. As a reminder, the enrollment broker will mail out the enrollment packets to beneficiaries. In the enrollment packet, the beneficiary will receive a notice that describes what NC Medicaid Managed Care and NC Medicaid Direct is, what they need to do next, and how to complete the next steps. They will also receive a health plan choice guide with all the health plans, the additional services they are offering, and if the health plan is only in select counties. They will receive an enrollment form with the beneficiary names and Medicaid ID pre populated for those who can enroll. The tribal exempt notice and tribal excluded notice will only be sent to tribal IHS eligible beneficiaries in the tribal service area. The tribal IHS excluded population will receive the transition notice, but will not receive the other materials in the enrollment packet. This is a sample transition notice that a Medicaid beneficiary would receive if they must enroll in NC Medicaid managed care. You'll see that the letter is addressed to the head of household. The first page of the three tells them what is happening and defines health plan and NC Medicaid Direct. It also tells them that if they previously chose a health plan in 2019, they must choose again. The notice encourages them to make the choice. The second page informs them of who must choose a PCP and health plan by May 14th, 2021. Refer to the box in red. The second page also provides the three steps they need to take to enroll. 1. Choose a PCP. 2. Choose a health plan. 3. Enroll via the website at ncmedicaidplans.gov, through the NC Medicaid Managed Care mobile app, by calling the call center, or mailing or faxing in the completed enrollment form. The third page provides the last date to choose a health plan. The notice encourages them to take action and enroll. If they decide they want to change their health plan, it informs them that they have until September 30th, 2021 to do so. It explains that they will not be able to change their health plan after that date without a special reason until their next Medicaid recertification date. At their Medicaid recertification date, they will remain in their current health plan, but will be given a 90-day choice period, which will allow them to change if they want. If they feel they should not enroll in a health plan due to developmental disability, behavioral health, traumatic brain injury, or substance use disorder, it provides them the contact information in order to request a reconsideration. What happens next? It tells them to expect a welcome packet with their new Medicaid ID card. If they have questions about that ID card, they will need to contact their health plan, and the contact information will be on the back of their ID card. It then provides the contact information for the enrollment broker if they have questions. The enrollment packet will also include an enrollment form that the beneficiary can complete and mail or fax back to the enrollment broker. It will have the names and their Medicaid ID pre populated, as well as the health plans available in their county. These are marked with an arrow to show you where that information would be. While the enrollment packet will include this enrollment form, beneficiaries can also enroll via the website, mobile app, or by calling the enrollment broker. The EBCI tribal option will only appear on the enrollment form mailed to tribal IHS exempt beneficiaries in the tribal service area. Beneficiaries will receive the health plan choice guide with information about the health plans, including contact information. Beneficiaries will have 6 health plans to choose from when they enroll based on where they live and their eligibility. The health plan choice guide includes EBCI tribal option, WellCare, United Healthcare, Healthy Blue, AmeriHealth Caritas, and Carolina Complete Health. It provides their phone number, their TTY number, their website address, and the days and times their call center is available. It also provides a picture of what their Medicaid ID cards will look like. At the bottom, it lists the counties that the EBCI tribal option and Carolina Complete Health are available in. If they have any questions, it directs them to contact the enrollment broker. The goal of the enrollment broker is to meet the beneficiary where they are. The enrollment broker offers a multi channel solution for North Carolinians. New self service options and user friendly avenues for obtaining program information, choosing a health plan, completing enrollment, and receiving assistance are all designed with the beneficiary in mind. The enrollment broker can provide choice counseling and enrollment completion services through a variety of different channels. We will review a few of the primary channels in the following slides, including the ncmedicaidplans.gov website and web chat, the NC Medicaid Managed Care mobile app, and the Enrollment Broker Call Center. These are the channels that beneficiaries can use to enroll in NC Medicaid Managed Care, in addition to mailing or faxing in their enrollment form. Community partners should direct beneficiaries to the website ncmedicaidplans.gov to learn more and chat with an enrollment specialist. Additionally, they can download the NC Medicaid Managed Care mobile app or call to speak with an enrollment specialist. This call is toll free. The enrollment broker will also provide outreach and education, as we are doing today, about NC Medicaid managed care. But beneficiaries will still need to enroll via the website, mobile app, enrollment broker call center, or by mailing or faxing in their enrollment form. Beneficiaries may choose to enroll in the way that works best for them. ncmedicaidplans.gov is designed to enhance online access to program services and provide a seamless enrollment experience. The website is compatible with Internet Explorer, Microsoft Edge, Firefox, Chrome, and Safari. The website also includes features to adjust font preferences and transition to English or Spanish. The enrollment broker supports paperless communication with beneficiaries. If they are not enrolled in paperless, the enrollment specialist will educate them about the option and offer to enroll them. More information on these options is available on the website. There are two parts to the website: one, the public website with general information, and two, a secure web portal for enrollment. The information shown in the Medicaid and NC Health Choice Provider and Health Plan Lookup tool comes from NC Medicaid and the health plans. The beneficiary can filter their search results based on provider type, provider specialty, provider last name, languages, gender, plan participation, and location. The provider's network status will be listed based on the health plan details the beneficiary used as their search criteria. They may also view different health plan benefits. The Health Plan Selection tool uses a provider directory to determine provider health plan relationships so that beneficiaries see up to date information on provider availability. To assist the beneficiary in selecting a health plan, the beneficiary can select and view up to 3 health plans side by side. This allows the beneficiary to view details such as copays, information on the services the health plan covers, and the health plan's website and telephone number if the beneficiary has more detailed coverage questions. Beneficiaries can also access a PDF version of the Health Plan Choice Guide in the Enrollment Materials section of the website. Beneficiaries will use the Medicaid and NC Health Choice Provider and Health Plan Lookup tool to determine which plans their doctors and other providers participate in. The information shown in the Medicaid and NC Health Choice Provider and Health Plan Lookup tool comes from NC Medicaid and the health plans. As a reminder, there are two parts to the website: the public website with general information and a secure web portal for enrollment. The public facing portal will include all active Medicaid and NC Health Choice providers, regardless of their PCP status. The secure portal can be used by beneficiaries for health plan and PCP selection. Search results in this portal will only include active Medicaid and NC Health Choice providers that are PCPs. EBCI tribal option eligible beneficiaries are encouraged to search by organization for a health plan or use the secure portal on ncmedicaidplans.gov. Searching by organization allows beneficiaries to see if their provider's practice is affiliated with a health plan, including the EBCI tribal option. The secure portal on ncmedicaidplans.gov shows individual providers and organizations within the EBCI tribal option network. PCP assignment links the member to the practice, not an individual provider. EBCI tribal option members are not limited to receiving services only from providers participating in the EBCI tribal option. They may also receive services from any Medicaid or NC Health Choice provider, including dentists, specialists, hospitals, and pharmacies. The web chat feature on the ncmedicaidplans.gov website provides a real time assistance channel for users visiting the website. Every page has a Chat with Us button that users can click to begin a chat conversation with an enrollment specialist through a secure web portal. The enrollment specialist staffing the web chat will respond to incoming chats within 20 seconds. Beneficiaries will receive a pre chat survey asking for basic information, including their name and topic of interest. Topics include general website information, general Medicaid information, provider questions, view health plans, enroll, disenroll, or change health plan, check enrollment status, request information for my health plan, update contact information, update authorized representative, form requests, and lost or stolen Medicaid card. Enrollment specialists who will provide chat assistance must demonstrate strong writing abilities, including proper grammar and accuracy in spelling. Enrollment specialists will be cross trained in phone based and web chat assistance so they can seamlessly and quickly switch from phone to chat if necessary. Enrollment specialists will document all beneficiary interactions, including web chats, in their system for complete tracking and reporting across all channels of communication. There is also an online satisfaction survey directly following each chat session. The NC Medicaid Managed Care mobile app is available for iOS and Android devices. It is available for iOS version 10 or higher and Android version 7 or higher. The app can be used in English or Spanish as set by the user preference. Beneficiaries can use the app to choose a PCP, health plan, and enroll. This graphic highlights key features of the NC Medicaid Managed Care mobile app. Like the website, users can use the app to view health plans, search for PCPs, complete enrollment, and make changes to their health plan and provider choices. The NC Medicaid Managed Care mobile app will perform a real time lookup with NC Fast to pull the most current beneficiary data before their case information is displayed on the screen. After authenticating as the head of household, the user will be able to view enrollment information about each person tied to the case. After authenticating as the non head of household, the user will only be able to view enrollment information about their case. With the NC Medicaid Managed Care mobile app, users can also make enrollment changes to one person at a time. After choosing to make changes to enrollment choices, the user will be prompted to confirm household communication preferences, where they can update the household email address, opt in or out for email messages, update household cell phone number, and opt in or out for text messages. The user can make changes to an enrollment by choosing a health plan or a provider first. For users that choose a provider first, the system will only display health plans that are associated with the chosen provider. For users that choose a health plan first, the system will only display providers that are associated with the chosen health plan. Users must have a valid username and password to use the app to enroll. If they do not have a username already, they can access registration from the NCID login screen within the app. If they are successfully authenticated and it is their first time logging into the app, it will prompt them to provide their first name, last name, date of birth, and either the last four numbers of their Social Security number or their Medicaid ID. Users who have NCID access issues should contact the enrollment broker for assistance. Within the mobile app, users can see all health plans available in their county. They can also access the Health Plan Choice Guide to view more information about the health plans available to them. They can also select their health plan directly with the mobile app. Authenticated users will be able to select a provider or skip the selection of a provider. They can view provider information via a list view, shown on the left, or a map view, shown on the right. The mobile app will display the health plan and PCP, if chosen, for the beneficiary prior to being able to complete enrollment. The app will display terms and conditions that a user must accept prior to being able to complete the enrollment transaction. Enrollment specialists can be reached via phone by calling 1-833-870-5500. For assistance via text telephone, beneficiaries can call the TTY number at 1-833-870-5588. The call is toll free. Enrollment specialists are available at the call center for support Monday through Saturday from 7 a.m. to 5 p.m. and for extended hours, 7 a.m. to 8 p.m., 7 days a week during open enrollment. Open enrollment is from March 15th, 2021 to May 14th, 2021. Enrollment specialists can provide choice counseling for health plans and PCPs, as well as complete enrollment over the phone. For beneficiaries who do not speak English, help is also available in other languages. The enrollment broker has an outreach team dedicated to community and beneficiary engagement, as well as tribal community outreach. The enrollment broker will provide two types of events and outreach: partner engagement to educate and engage partners, and community outreach to educate beneficiaries. These events will either be virtual or in person following CDC guidelines. Partner engagement events are designed to facilitate education and grow relationships in the community. Types of events include community education, virtual presentations, and virtual meet and greet, and community events, virtual informational meetings. Community outreach events are designed to prepare beneficiaries for the changes they will encounter with NC Medicaid managed care. Types of events include community education, virtual presentations, community events, virtual informational meetings, and virtual enrollment events. Types of materials provided include marketing materials, flyers, and fact sheets. On ncmedicaidplans.gov's homepage, beneficiaries can click to navigate to a page where they can search for events by their county. Community events by county are listed on the website with event information, and the website will be regularly updated. The materials shown here are intended to help you inform beneficiaries about NC Medicaid managed care. All materials are intended to let beneficiaries know that they need to take action to enroll in NC Medicaid managed care. The materials also provide appropriate contact information for the enrollment broker to help beneficiaries learn more. All materials will be available for download on the county playbook. The poster informs beneficiaries that change is happening and that they need to act. It highlights what they need to do and who to contact with questions. This is an 11 by 17 poster. Organizations like yours can hang this in your local offices. The fact sheet is a two-page front and back document at a standard letter size. It provides more detailed information, including how to choose a health plan and primary care provider. It also lists important dates and contact information. You can share this with beneficiaries who must enroll or may choose to enroll in a health plan. The tribal handout is a two-page front and back document at a standard letter size. It has been developed for tribal IHS beneficiaries. It provides more detailed information specific to the tribal population and includes information related to the EBCI tribal option and other health plans. It also lists important dates and contact information. You can share this with beneficiaries to help them learn more about what they need to do. The Palm card serves as an easy reminder for beneficiaries of what they need to do and how to get answers to their questions. It is a standard business card size. It can be given to beneficiaries as a reminder to take action. The flyer outlines what beneficiaries need to do and tells them how to get more information. This piece is ideal for making available in office lobbies and at staff member desks. It is a half sheet size. The NC Medicaid Managed Care introductory video educates beneficiaries about NC Medicaid Managed Care, including health plan options and what they need to do. It is a 4.5 minute video that will be hosted online and can be played with or without sound. The video addresses what is a primary care provider, what is a health plan, the health plans available, what beneficiaries need to do, what happens after beneficiaries enroll, key dates for enrollment, and how to get answers to additional questions. Throughout the transition, the enrollment broker will share information with beneficiaries at a local level through a variety of community events listed by county. These will be listed on the website and regularly updated. On the ncmedicaidplans.gov homepage, there will be a meeting and events option they can select. From the meeting and events page, shown here, users can select their county from the drop-down menu and hit go to view results. After entering the county, any results will display beneath the search box. Beneficiaries can enroll in NC Medicaid managed care in several ways. Online, through the website at ncmedicaidplans.gov and chat feature, beneficiaries can get answers to their questions about NC Medicaid managed care. Once they are ready to enroll, they will follow a link from the website, which will walk them through the process to complete enrollment. The mobile app is free and available on Google Play or from the Apple App Store. Within the app, beneficiaries can choose their PCP, view the health plans, and enroll. Enrollment specialists are available by phone to help beneficiaries select a primary care provider, view health plans, and enroll in a health plan. Help is also available in different languages for those who do not speak English or are more comfortable communicating in a different language. The call is toll free. Beneficiaries will receive a paper application in the mail as part of the enrollment packet. They can choose to complete this application and mail it back in the prepaid envelope provided. They can also fax in the completed form. As a partner, you can help ensure beneficiaries know where to go for different questions. DSS will still be responsible for answering all questions related to eligibility. For all questions related to choice counseling or enrollment, beneficiaries should reach out to the enrollment broker. The enrollment broker can also provide support for the mobile app and website. For beneficiaries who stay in NC Medicaid Direct, questions about their benefits and claims should be directed to the Medicaid Contact Center. After enrolling, members should contact their health plan for benefits, replacement cards, and change in PCP. EBCI tribal option members should contact DSS for replacement cards and change in PCP. This slide shows the contact numbers for the different health plans available through NC Medicaid Managed Care. You can keep these on hand for members who ask for contact information for their health plan. The health plans are EBCI Tribal Option, WellCare, United Healthcare, Healthy Blue, AmeriHealth Caritas, and Carolina Complete Health. Thank you for joining this presentation on NC Medicaid Managed Care.